Almost all the health and well-being services provided in Powys are now co-produced with the people who use or care for those who use the services.
The partnership boards that plan and deliver services all have citizen representatives as members, and their expertise and experience is invaluable to making sure these services are as effective as possible.
When someone gives up their time to share their experiences, it is important that they feel that they have made a difference and that they have been listened to.
They need to feel that they have shared power in the decisions that affect their lives.
Why is it better to work with people when planning and delivering services that they use?
We give a unique perspective on how services are run. We are very creative, and given responsibilities, we can come up with an amazing idea to tackle an issue that you don't even realise was there. We are not driven by money, we are driven by passion. We want to be involved as much as possible to make a difference.
To truly share power with citizens, we need to understand the nature of power and how it can be given or taken away from people. One way we can do this is the power cube. Picture a three-dimensional cube with three faces, each representing a different aspect of power and how it affects who can take part.
The first face is forms of power. Visible power is the power you can see.
It's local elections, it's the Senedd. It's a school board of governors. Or it could be the United Nations.
On the surface, it looks like anyone can get involved, and all decisions are transparent and accountable.
But then we have hidden power. This form of power is when certain issues are kept from public view. Decisions made behind closed doors. Powerful forces could control what is brought to the table.
For example, gun or tobacco lobbyists in America. From the outside, it might look like there is a choice, but many options may already have been removed by the real power holders. It is important when working with citizens in co-production that they are involved in decision-making as early as possible, so that they can see all the options and not feel like their choice is limited and they are just there as a tick-box exercise.
Another way people can be disenfranchised is through invisible power. These barriers could be ideological or psychological. An idea, usually ingrained into a society's belief and behaviour, can stop people from trying to influence decision-making. It is this sort of hidden power that meant we only had the first Black American president in this century, or that we have never had a female leader of the Labour Party.
On a smaller scale, this invisible power might mean people with mental health or substance misuse issues might feel like there is no point trying to affect decisions as they will not be listened to. Changing this can be a long process, but it is possible by breaking down stigma and making sure success stories are shared out to a wider audience. Allowing people to see that it is possible to make a difference, no matter your background, gender, class, or other factor that they feel limits them.
I think a better understanding on how and why decisions are made, that might have helped. There's also a perception of still there's this idea of us and them, and I feel that in the past, we've been given labels. It's kind of that, it's, oh, you're a carer, or oh, you're just an alcoholic. But we're also experts through our experiences, and we need to be able to look beyond those labels and work together to put the services, or make the services as good as they can possibly be. Like when the professionals on the partnership board see us as people, or maybe even consider our other skills, then together perhaps we can make a difference.
Acronyms are so annoying. Any jargon and technical speak. Even though we know the services, we don't use the language that professionals use, and I can get lost in all the initials being used.
Spaces of power. A closed space is when decisions are made behind closed doors. Citizens are generally excluded from this, and power is held by the elite, who offer no co-production outside of this space for the public. Thankfully, public services are rarely run in this way, and at the very least invited spaces are used to work with the public. This can include legal spaces, council chambers, or a hospital.
However, it can still cause barriers, as these invited spaces might have rules or traditions that are unfamiliar to the public. The House of Commons has many traditions that seem outdated and unhelpful to anyone wanting to understand the nature of power.
Even a partnership meeting can be daunting when a member of the public tries to take part. We often hear from people that jargon is one of the main barriers to them contributing at meetings, so try to consider how an outsider might view your normal way of making decisions and look for ways to involve them and simplify the process.
Of course, the best way to involve people is to work with them in their claimed spaces. This will be somewhere they use regularly and where they feel at ease.
You might be able to see their issues firsthand and have a much better response to any collaboration efforts and speak to people who would not attend a meeting in council offices. It could be a community centre or a cafe where a group of people meet, or a space owned and managed by the people you want to speak to, or a service they use, like a substance misuse service.
Recently, we organised some events for the Area Planning Board to get views on substance misuse services in Powys. We held them in different places all over the county, but one of the most memorable was in Ustragunlais. It was at the community centre, which had recently been taken over by a local action group. Being in their space made everyone feel comfortable, and we heard a lot of personal stories and experiences that we might not have heard through a generic survey. The professionals who attended were able to see firsthand what was happening on the ground. Doing it this way gave better outcomes for everyone involved, and people really felt that they were seen and listened to by the people making decisions on their services.
Yeah, it was a bit intimidating, especially the meetings, like at the councils, in their place, the county hall. Everyone up there, they're all like wearing suits. They all knew each other, and I just felt kind of out of place. But then when we do it at Kaleidoscope, that's the substance misuse place, I just felt more comfortable there and a lot more relaxed.
The final face of the power cube is levels of power. These are divided into local, national, and global.
It is simply at which level you are trying to make a change. An issue like hospital services will be discussed locally by people involved in that decision. However, some decisions are made nationally or even globally, and even the health and well-being professionals have no power over this.
Having an understanding of what level you need to be interacting with to make change will help the people you are working with make a difference.
I'm a rep on the local mental health partnership board and also volunteer for a patients' council, where we listen to people's experiences and issues they have on the local mental health ward. I can pass on these experiences to the local mental health team, and if they need to make changes to their service, they can act on this feedback. I'm also on a national forum, and this has reps from other regions' local partnership boards. Issues we raise here are directly heard by the Welsh Government, and together the views we have collected from our local areas can provide a strong voice that is heard by those in power. However, there's still some attitudes and ideas which are global. For example, medicalisation of mental health, which would be hard for us to address at a national or local level. It's important for me as a rep to know which level I need to take issues to and where the decisions are made. If it's regarding national policy, then I can take it to the national forum. However, something like stigma is a global issue and may seem like we aren't making much difference. I have to hope that long term, even a concern raised at local level can have an effect globally, as we can all change attitudes at every level, however long it takes. I feel like I have a good understanding of the levels of power now, but it's something both reps and professionals need to be aware of.
For example, dial-a-ride services or substance misuse service tendering is usually a local issue. The co-occurring issues of substance misuse and mental health service access is decided nationally. And then medicalisation of mental distress and the power of drug companies in this area is a global issue. Understanding this and making sure the representatives do too is vital in effective co-production.
The three faces of the power cube have a relationship with each other. The space you use can affect the perception of whether the power is visible or invisible, for example. Global attitudes can affect long-held beliefs about who should be involved in decision-making. When you are planning engagement events, consider all the aspects of the Power Cube and use it to ensure effective co-production.
How can you work with the Cube to improve the accessibility to power sharing for citizens?
Do some of your processes exclude people? Could you hold meetings in different areas of the county? What opportunity is there for people to get involved in national or global decision-making? How are you celebrating successes to show the effect people have had in making these decisions?
Services work best when you involve people who use those services in the planning of them. The fewer barriers there are to them collaborating with you, the better results you will get. One of the most effective ways of making sure you work well with citizens in planning services is to ask them what works best for them. What has helped them and what hasn't helped them when they have been involved in co-production?
Here's a final word from the representatives themselves on how to best involve them in the planning and delivery of services.
If there are barriers, issues or difficulties you have in your job or service that affect the service you offer, share that with us. It helps us to see things from your viewpoint and why certain things aren't possible or why something isn't working as it should. We might even be able to provide solutions.
We need to be seen as more than the label given to us, that we do have a different hat, as do they, for various roles in life. Yes, I am a carer, but I have an identity and experience beyond that. If you just see me as a carer or as a service user, then I fit into a hierarchy, and that makes working in an equal partnership more difficult. I'm also a mother. I used to be a nurse. All of this adds to my experience, so work with me and use that experience.
Please hear what we say and act on it, and don't just listen. Let us and other people know when we make a difference. Sometimes it can look to us that progress is slow, but if you are using our work to make changes, letting us know helps us to realise you are hearing what we say and using it. Shout about our successes, and other people might then want to also have a say in making change.